Good morning, everybody. Sorry, I just dropped my iPad the moment that the video started. Forgive me. Dr. Erica here again, and wanted to talk a little bit about a patient who I saw this week in the office. I'd like to share with you when something cool happens, because it might just help you. I'm sorry for jiggling this around here. This past week I saw a patient, a really nice fella, who came in who has all kinds of pain, and you know that's not so unusual in my practice life, right? A lot of people first seek out chiropractic care, unfortunately, when they hurt, and so I saw him, and he explained to me that he'd had in the past neck pain, shoulder pain, and he had rehabbed it. He'd done physical therapy. He was very, consistent about doing his exercises, and it took him like months to fix this neck and shoulder pain, but he did it. And then later, he started to develop this tightness in his hip, and pain that went like down the side of his body and down the leg and to the foot. And he'd been to a fair number of doctors, physical therapists, and even a few chiropractors, and he came to see me after his wife, who was also a patient of mine, came in to see me as well. So I thought, wow, no problem. I'm going to do my chiropractic exam. I'm going to adjust him, and it's going to turn the lights on, and we'll be good. So I did my chiropractic exam, looked at his range of motion, which was only slightly hampered. He had some pain in the areas that he described. And what was interesting, too, about his pain pattern, I should mention, is that if he touched a certain area on the chest or on the side of the body, he would feel it all the way down his leg. And that's not a typical referral pain pattern. It doesn't follow the nerve roots the way many other kinds of pain do. And I thought, well, that's interesting. So I just kind of put it back here in my head for a little while and went about and did my regular exam. So I adjusted him, and I thought, fantastic, let's give this a couple days and we'll come back for a report of findings. So he did. He came back for his report of findings. I discussed his findings with him and made some recommendations and so forth. And I said, so how are you doing since the last visit? Are you feeling better? What's different? And he said, absolutely nothing. And I went, what? Nothing? And he says, yeah, it feels exactly the same. It's always been like this. Maybe I'll have, an hour or so of feeling relief, but it came right back. I was like, wow. Because, one of the cool things about being a chiropractor is that, which actually a lot of other healthcare providers don't get this kind of satisfaction, I have to say, is that when we put our hands on people, it changes lives. People who have suffered for years with debilitating illness and injury get better through what we do. So it's a little unusual when, nothing happens. So I said, well, that's not good. I said, so are you ready to get really radical about treating this? And he was like, well, yeah. And I said, okay, you know what? Let's scrap that care plan I just gave you and do something completely else. And one thing I want to encourage all patients, and also my colleagues too, is that if something doesn't work, it's okay to go back and start again and do something completely else. And every patient I've ever met in this kind of situation has appreciated it. Don't keep doing the same thing over and over again, hoping that, well, it's just going to take time. And sometimes it takes time, but feel free to change what you're doing. So I did. I said to him, how would you feel about acupuncture to help deal with this? I said, because when I look at your pain pattern, it's all on the right side of your body. And he even said so. He says, there's something wrong with the right-hand side of my body, because everything is from here, this shoulder, this hip, this side of my body, this rib, it's all on the right-hand side. And I said, it seems to me that all these points are along the gallbladder meridian and also along the liver meridian, which are paired meridians, by the way, in Chinese medicine. And there's something up here. And he said, sounds great. He said, oh, by the way, there's something else I didn't tell you, and maybe this is important. I said, okay. And he said, you know, since I've had this pain, I have this situation where there's like this bubbling or gurgling right down, you know, low here in my gut. Do you think that's related? And I said, well, yeah, because if you have inflammation in your gut, there's something wrong with how the ileocecal valves and valves of Houston are working. And by the way, I did a video on that stuff, so if you want, go to YouTube and check it out. I did talk about those valves and how they're important. So if they're not working right, or you have dysbiosis and your gut is screwed up, you have this constant stream of inflammation, like this toxic soup that's coming out of your bowel and sometimes leaks into your blood system. We call that a leaky gut syndrome. And you know what's not too far away from your gut, by the way, is your spine, right? And the nerve roots that come out of the spine. You know, that area not only controls the muscles that we think about, but also the organs in that same area. So if you have like this toxic waste dump in your gut, it reflects back into the spine, and it can then also be felt in the musculoskeletal system as well. Not all myofascial and muscular issues are just a muscle injury. I mean, you can, you know, if you strained a muscle doing an activity or something, you know, for sure, all the muscle work in the world is phenomenal and adjusting as well, but that's not always how it comes about. You know, fascia intertwines around all of our organs, all of our muscles. It's what gives us kind of our shape, and it has a tensile strength of something in the order of 2,000 pounds per square inch. That's really strong. You know, if you think about, I always tell my patients, if you think about the movie Rocky, where, you know, Rocky is hitting the cows that are, you know, the cow carcasses that are hanging up in the large slaughterhouse, the reason they can hang on those hooks and not just fall to the ground is because the fascia, the animal's fascia around the bones and the muscles holds it together. So I know, kind of gross, but you get a sense of how strong our fascia is. So I said to him, okay, so let's figure out how to do this. I said, we could either do you know, a zillion hours of myofascial therapy, which, number one, takes that long, and also is a lot of work for me, and also it's a lot of work for the patient to endure. It can be very painful sometimes, the best myofascial work. I said, how would you feel about doing an ancient practice of acupuncture? And he said, sounds great, let's do it. What is it? And I said, well, there are these points on the end of the toes, and they're also at the end of the fingers too, called jing points. And the jing points are used to strongly stimulate that meridian, usually along the pathway or at the opposite end. And so I said, you know what, let's bleed these points and see if we can get your body's energy and also these fascial restrictions to let go. He said, awesome. So the first thing we did was to look at the range of motion of his hip, because that was the area that he felt the most restriction. And while it wasn't terrible, it wasn't easy, and I figured there could be much more range and ease he could have. So I got on my gloves, and I found my lancet, and we take the lancet and use alcohol over the toe, in this case actually 3 toes, and then we fire the lancet right into the corner of the nail. That's where these jing points are on the toes. And I squeezed out about 10 drops of blood per point, and, you know, wicked it away with a cotton ball, and then cleaned him up and all that. And then I said, move your hip, let's see. And so he did. And he was like, wow, that's much better. I can move. He stood up. He was able to kind of move the pelvis, the lower spine, everything just kind of like opened up. And I said, that's pretty cool. Because that took me, I don't know, 7 or 8 seconds to do, and it really made a huge difference. So I said, I think we're onto something here. And there's more than one thing to do, right? Because there is this myofascial part. There may be a persistent postural part, which we're going to continue to look at. And there may be also this nutritional part as well that we need to get really fully taken care of. So the next day, he came in, which was like about a week or so later. I asked him how he was doing. He says, wow, you know, had about 4 days where I didn't have this constant tension in my hip. He says it's kind of back now, but it was really different. So I did this again to bleed the points on the foot, and I also took a look at his pelvis, which was like really rotated and elevated on one side compared to the other. And where he put in his shoe a little heel lift that's made out of this silicone material, and it held the pelvis in place. My hope, honestly, is that he won't need this going forward, forever, because, it's kind of a pain to have to wear a heel lift all the time. If he needs it, he needs it. But I'm hoping that as his body unwinds and as his fascia unwinds, that he will have less and less use for it and we can get rid of it. So that was, excuse me, that was the last visit. Looking forward to the next visit, we're going to really look at the entire pelvis, the entire hip, what muscles are not working properly, what ones are, and use those muscle tests as a form of, like as a window or a door to the central nervous system. Remember what I said about the gut being shared innervation with the hip and pelvis? Well, it is. So if we continue to find inhibited, what we would colloquially call weak muscles around the pelvis, those muscles are related to different organs. The adductors of your hip are related to sex hormones. The lateral stabilizers and abductors are related to the large intestine. Some of the hip flexors are related to kidney function and adrenal function. There can be a whole world of things possibly that relate to this issue, and I intend to find out what it is. So I try not to guess too much in advance of my examinations, what I think it's going to be, because one of the things that I think all kinds of healthcare providers do on a regular basis is like we kind of turn it around in our head and we think like, I got it. And we need to be a little more patient and wait for the evidence to come about, whether it's in blood testing and muscle testing or palpatory examination or whatever else it is. You just have to be a little patient and wait for the body to tell you what's wrong. But because I think in this way, something does come to mind to me. I do think that the perpetual weakness and also tension, the amazing myofascial tension that's in the abductors of his hip, are probably related in some way to the large bowel. And I feel pretty safe in making this hypothesis because he told me that in the lower part of the bowel, where the colon is, that he hears all this gurgling all the time, and he's only felt it since the hip has been like this. So I'm thinking about what can I do to help him with this. One possibility certainly is a wide range of probiotics, prebiotics, both in terms of foods as well as possibly supplementation if needed. Another possibility is chlorophyll. Chlorophyll is wonderful for helping to restabilize and alkalize the gut as well. It helps for our natural detoxification process, things like that. I'm also thinking he's probably got an open or stuck shut ileocecal valve, or in this case a valve of Houston because it's on the right hand side. There could be really a lot of things to look at. And my point is that to our patients out there, or our prospective patients out there, is that when people come into the chiropractor, and really actually other healthcare providers too, and say, it's my hip. It's just my hip. I want you to work on my hip. Doctor, touch it right there. I got to tell you something. That kind of thing drives chiropractors crazy because we're pretty good at examining the body, actually. We have an amazing neuromusculoskeletal education, among other things. But a lot of the times, as Dr. Viktor Frankl, who invented total body modification and developed it for over almost 50 years, said, you don't have what you've got. And what he meant by that was that just because you have a pain or a symptom or something in a particular area doesn't mean that's actually the primary problem itself. We have to look at all of these tangential and related things to find out what will make the biggest difference here. So I have to say I'm kind of excited about this particular case to see how we can bring together, our Western understanding of myofascia, the Chinese understanding of the musculotendinous meridians and the actual channels themselves, nutrition, and a functional medicine approach. And it all kind of comes together, for me anyway, in the applied kinesiology approach that allows all these systems to, and more of them, to work together as a whole. I find it very interesting and very challenging, and those kind of patients who are not simple like that, I like to put them at the end of the day, so if I need to take more time, I don't want to be rushed by, having to produce results right in that second when there are other patients waiting and all that. So it's important that when you have something that's complicated like this, that your provider has time to chill out and spend with you and allow not only their technical skill but also their intuition come into play when treating. I'll give you another, I don't want to take you for too long here, but just one other quick case that is very similar to this, that I think you'll also get another sense of what I'm talking about. I had a woman about probably a year or two ago now who came in with excruciating shoulder pain. And you look at her and she's very fit and very athletic. She's always in her workout clothes, very active person, eats healthy, good skin, the whole 9 yards. And she had this horrible shoulder pain. And it happened after she was exercising, and she got hurt. And she went to an orthopedist. She had injections into the shoulder. She had lots and lots of physical therapy. And it just never helped for more than a day or so. And she was absolutely religious about doing her shoulder exercises, because if she didn't, then she could not even move the arm, anywhere near shoulder level. And I was, I think, the fourth chiropractor or something she saw, so that's very pressure inducing. And I said, okay, let's check it out. We had filmed the last physician who saw her, saw that she had some disruption of the acromioclavicular joint. So I started to work on her, and I adjusted her first time, and it helped for just a very short while, and then it undid itself. And then I said, okay, well, something else is here. I also challenged the acromioclavicular joint. When we compressed the joint, she could actually bring her arm all the way up. So we put some very rigid hockey tape on there. By the way, hockey tape is the bomb. Made by the folks at Renfrew. It's the stuff that the hockey players put around the handle of their hockey stick. But I'll tell you what, if you want a joint not to move, and you want some tape that will pretty much outlive any major world catastrophe, it's hockey tape. So we took some hockey tape and put the joint together, and that gave her range of motion. So that was interesting. And then after a while, that stopped working as well. She had some range of motion, but the pain would just come back. And I'm working on her, and I'm doing muscle work, and she says, there's something that happened a year ago that I never told you about that maybe would help. I love that. I really do appreciate a full history in advance, but it doesn't work out that way. People forget things. So I said, okay, well, what's that? She says, I've always been a healthy eater, lots of fruits and vegetables and fish and this, that, and the other thing. And she says, all of a sudden, just like that, I had to have my gallbladder taken out. I had incredible pain, and in my gut, and I didn't know what was wrong with me, and my husband took me to the ER, and I had to have my gallbladder taken out. And I said, oh. And then I went, oh. So remember this guy I was just talking about? The side of the body is controlled by the gallbladder meridian and the liver, its partner, right? And I went, oh. I said, did anybody ever give you any care for your liver or gallbladder after that? She's like, no, should they have? And I went, yeah, because you just lost your whole storage point of all kinds of enzymes and, fat, fat enzymes and all that. And I said, the gallbladder is not a disposable organ, we really do need that. Even though your liver keeps making bile and all that, you really do need your gallbladder. So I said, we should do something to see if we can help. So I actually had her in salivate, meaning taste test, a supplement by standard process that's called Liviplex. And I said, let's see if this improves your range of motion and makes your arm hurt less. And she was like, okay. And so she did, and up went the arm, and she was moving it, like she was at a rock concert, ooh, like this, right? And she was absolutely amazing. So was I got to tell you, I wasn't really expecting it to be quite so dramatic. And I said, I want you to take this 3 times a day for the next month, and let's see what happens. And she was so excited that really 2 weeks later she came back in with this huge plate of cookies and everything. She was so excited that she wasn't in abject pain anymore. And we kept the shoulder compressed with the hockey tape, and she bought her own roll so she could do it herself. And she's been doing great ever since. So what I wanted to share with you is that sometimes, a hip or a shoulder is not a hip or a shoulder. It's not, a cigar is not always a cigar, and that there are many different layers that happen in the body in terms of injury and recovery. And I think the best results personally happen when we look at things from a holistic approach. Applied kinesiology is a wonderful tool of many to help get to those answers. And I just really get tickled by those things. I love it when I see people get well. And I know I've kept you for a long time. I'm sorry. Are there any questions or anything before I let you all go? I'm happy to entertain any of these questions if you have any. Hey Danielle, you're my rock star out there. Danielle says hi today. Well, in any case, if you think of any questions, feel free to write it in the comments section here in Facebook. And if there's anything that you'd like to hear me talk about, happy to do so. A lot of these are impromptu. I woke up this morning early and I wanted to chat with you. So thank you for listening and for watching. And if you know of anybody who would benefit from hearing about this information, please include them in the post. Very happy to talk with you and them as well. So have a great day, and for all my members of the tribe, all my Jewish friends and family today, I'm wishing you a Happy New Year and a Chag Sameach and all good things, and all the best to you. Ciao.